Yeah, hello dear people, here we are again in our video series about the Buteyko method, and today we want to talk about hypothyroidism and its relation to the Buteyko method. So Dr. Rakhimov, may you first talk a little bit about the relations?
Yeah, hypothyroidism can be treated with the Buteyko technique successfully, and that's experience not only of Soviet doctors. I had students with hypothyroidism.
Me too.
And Buteyko had, Volker also had some students. And what would happen here is, when we start breathing retraining, we have quite heavy breathing pattern. As medical studies even measure it, people would have quite heavy breathing, meaning we would breathe at least twice more than the medical norm, day and night, meaning that they have chronic hyperventilation. Yeah. So that's a medical fact. All people with hypothyroidism, they breathe too heavy. And what happens next, our purpose, our goal is to slow down their breathing pattern. And when people start their breathing retraining, they quickly experience positive effects. For example, well, we have, depending on the person, which hormones we take, and like if we take a hormone, because some people try to avoid taking like additional thyroxine hormone or some other supplements. Dr. Buteyko, though, advised that when hormones are missing in the body, in many cases it is even necessary for them to have this supplementation, even though people often are afraid because we believe somehow that taking hormones like it can cause too much damage to the human body. But Buteyko's position was that when the certain hormone is missing in the body, people are not able to retrain their breath. And that was the reason, the cause why he was advising and teaching
or it will
patients
take a lot longer.
Can be too hard, difficult to make changes. So when people are provided with hormone, but they would commonly notice positive effects, having more energy, less sleep, because those people who have low thyroidal hormone sleep can get longer, people start to accumulate weight, people have again low level of energy, so cold hands, feet when they go to sleep. I have like these situations with students as well. These abnormal symptoms would start to disappear really quickly. Sometimes in 1-2 days people notice more energy, and then what happens next that if they measure later the situation, like let's say we start to retrain their breath and get up to 30 seconds, 35 seconds for the body oxygen test, that means we slow down their breathing already a lot, up to 2 times. Then doctor may do checks again and discover that the body starts to produce more hormone itself, meaning that the supplementation will no longer be necessary. And if we try to do the supplementation in the same dose as before, we can get overdose. So there would be negative effects of too much thyroxine circulating in the blood. So this is also not a good situation. And therefore it would be logical, of course, to either reduce the dose or stop it completely with time. So Buteyko breathing allows them to achieve complete normalization of thyroidal function, meaning that students are able to live normally without taking any thyroxine and without these debilitating symptoms that they experience. They start to have normal weight easily, we are able to do exercise, their sleep gets shorter and better quality, so we feel the whole body gets warmer, so kind of more energetic, and that allows them to stop any medical treatment if they had any, and have a normal quality of life. That was my experience with students. I usually would have students who would, depending on the person, I would say in the range of 1-2 month time, if we practice, we need of course to invest time, like 1 hour of breathing exercises, 90 minutes of breathing exercises per day, and plus physical exercise. And we're able to slow down breathing, of course, provided that we follow many lifestyle changes that we teach during the course that relate to sleep, diet, physical exercise, and many others. And that's a really good solution, because in my experience, all students I had, and you had also a few students.
I had also a few students, yes. It was the same. Like, most of them could reduce their medication after a while, and then later they didn't need any medication anymore. So
and
it was quite common.
Relatively fast, because like people often spend many months or years even.
And even to the surprise of people, because doctors were telling them it's impossible, that there's a recovery of the gland, and so they were sometimes even quite surprised that this happened.
Yes, officially, because it's like kind of incurable condition as we believe, but changing breathing pattern, the way again automatic and conscious, the way we breathe, slowing down our breathing back to the norm, relaxing our mind, our muscles, that would help us to retrain our breath, that would allow to achieve complete clinical remission in people with